with a little trivia question. Does anybody know who this gentleman is? This is Dr. Merton Root. He's considered the father of podiatric biomechanics, and he was a great inspiration to me in my senior year at podiatry school. I was a co-author of the final paper that Merton Root ever published, and this was in 1980 when I graduated from podiatry school. 1980, probably most of you weren't even born. But I'm going to take you back to 1980 because our podiatric biomechanics training was superb. We learned all of these segments of the lower extremity, starting with the pelvis, the femur, the tibia, and the joints within the foot. And we learned intimately how these joints interacted with each other and how pathologies would affect these joints. But interestingly, when it came to treatment modalities for biomechanical abnormality, this is what we had. In 1980, it was one modality, the custom functional root balance foot orthosis. If a patient came in my office back in 1980, as this patient did just about 3 years ago, and he walked like this, I really wouldn't have a modality to treat a complicated disorder like this. This is a common perineal nerve injury in a 26-year-old male patient that leaves him with a flaccid drop foot. But we can now today intervene with very simple but rather effective podiatric ankle foot orthoses that will adequately address the neuromuscular imbalance and almost immediately restore a normal gait pattern. It's experiences like this in clinical practice today that can actually be among the most gratifying in anybody's career. So today, if we look at what podiatric physicians in the United States have at their armamentarium and compare it to back before 1995 when bracing was non-existent, how did we immobilize the foot and ankle? Well, we used things like taping and strapping, bandaging, application of an Una boot was quite popular, compression wraps, and splints. But today we've moved into a new era where we apply functional bracing, ankle foot orthoses, as well as other modalities such as prefabricated walking boots, which help restore mobility to patients and affect very rapid healing and normal gait patterns. Just to let you know how popular these devices are in the United States compared to Europe, I just want to share with you a few utilization figures. These came from Medicare, and basically I added a few guess points as to how much more beyond Medicare patients are actually receiving these devices. These are known as walking boots. Last year in the United States, podiatrists alone prescribed over 50,000 walking boots. These are prefabricated ankle foot orthoses used to intervene for drop foot conditions. 7,000 units were dispensed by podiatrists last year with these types of devices. This brace was introduced in 1995, primarily to the podiatric profession, and now there are many braces similar to this utilized not just by podiatrists, but by orthotists, podorthists, and other lower extremity practitioners. Last year, about 15,000 Richie type braces were dispensed by DPMs in America. A similar, very popular brace is known as a gauntlet, and one of the popular brands is the Arizona AFO. Almost a similar number of braces were dispensed by podiatric physicians, 15,000 last year to patients. These are also very popular, prefabricated, hinged, low-profile ankle foot orthoses, actually even more popular than the custom devices. Over 20,000 were dispensed last year in our country. In summary, if we look at all of the utilization of ankle foot orthoses in the United States, over 120,000 units are dispensed each year. And I question how many practitioners outside the US utilize these devices to the degree that we do. And I want to share with you why we do this, how they work, and how they can greatly enhance your clinical practice.